Hey guys, Dr. DenBoer, Dementia Doc. Here I'm going to do a video on mental health variables, mental health problems associated with dementia for caregivers. So this is another video, I think video 16, 17 in my caregiver series. Again, friendly reminder to people is that I am not a licensed provider anymore, and this is not meant as medical advice. I'm a researcher and a professor in the area of geriatrics, and I consult with businesses. So anyway, here it goes. So, and appreciate the likes and follows. So let's talk a little bit about the mental health aspects of dementia. So there's the more obvious ones, and I'm talking about for individuals affected at this point. You have a lot of anxiety about the possibility of dementia, and that's made even more. Even more so when you think about the uncertainty of whether, if I'm a genetic risk, I'm developing it or not, etc. So I think that's a major piece here. So just the uncertainty and the anxiety surrounding it, that would be number one. Number two. Is the depression and the adjustment problems and the mood problems that come with this. That's another, major piece of this as well, is that we have adjustment and mood problems and certainly depression and sometimes reactive depression when we are given a diagnosis of dementia. As dementia progresses, people can have more anxiety that's more biologically determined, but then just anxiety associated with confusion and anxiety associated with uncertainty and anxiety associated with just looking back on one's life, perhaps with regret or just general adjustment problems. Also, the depression that comes with losing friends, being more isolated, etc., is certainly there. So that's another area that can be tremendously impacted here. When people are in more mid-stage to late-stage dementia, people can develop a major difficulty with remembering and paying attention and speed of processing, and that can be those variables can work from a biological perspective, like a primary perspective, but also from a secondary perspective to make people more depressed ultimately, and more confused. And as you get to a more later stage piece, then people can become have psychosis. So you can get psychosis as a secondary result of mental health or of dementia. So that would be not that somebody is primarily psychotic that has a psychotic disorder like schizophrenia, but they may experience psychosis for in regards to secondary to dementia. So these are things that we also need to look out for too. In terms of the caregiver side, there can be a lot of depression and anxiety, whether you're a paid or non-paid caregiver, probably more so if you're a non-paid caregiver in this format. So if you're a non-paid caregiver, you're probably much more likely to experience depression, anxiety if it's your loved one that's experiencing some form of dementia. You also, I would say not ironically, but you also are experiencing a lot of social isolation. So you're isolated from your friends, your family, from your previous routine, which made you happy, hopefully. Maybe you're exercising less, etc. So that's why it's important to fight against that and really do the proper socialization, book clubs, exercise clubs, etc. In this format. So super important here. So highly would suggest thinking about these things, being mindful about these things, and probably the biggest thing is just calling these things out, being aware of them and calling them out. Ultimately, that's going to be something that's going to be really influential here. So again, identifying, calling out, and then targeting and working against these mental health difficulties in dementia are super important. Again, thanks for the likes, shares, follows. Appreciate it. I hope you're taking care of yourself as holiday season starts. Thanks. Bye-bye.